Hey, I'm Ethan. I'm a pharmacist, and I got a question on YouTube the other day asking, do you serve methadone to your patients at your job, and do you enjoy it or not? Great question. To which I'd say yes and yes. So before I talk more about methadone, I just want to make it clear there's actually different indications for that drug. Not only is it for opioid use disorder, which is what you're probably referring to, in some instances, they do use methadone for chronic pain independent of any sort of use disorder. And when we're talking about opioid use disorder, there's other medications too. So there'd be methadone, you've probably heard of Suboxone or the injectable Sublocade, or even a long acting morphine like Cadian. But getting back to the root of your question, I know there is a huge stigma surrounding opioid use disorder, opioid addiction, everything in that realm. And it's really unfortunate. These people are really having a hard time and they need our help, whether it's ultimately self inflicted through coping or they got associated with a rough crowd or whatever the reason may be. Okay. These people are hurting and they need help. And pharmacists are far and wide the world's most accessible healthcare provider who conveniently happen to have expert medication knowledge. So, having the pharmacy as the hub for methadone dispensing, Suboxone dispensing, opioid agonist therapy, you name it, I think it makes sense, especially in smaller communities who don't have the luxuries of opioid dependence program or something to that effect. And ultimately, we're in the business of taking care of people, and I don't get to pick and choose. So if you come up to me and you need help, we got to figure out a game plan together. And it's incredibly disheartening to hear all this stuff on the news and in the online comments and wherever, there's this mentality of not in my backyard and I don't want to help these people and blah, blah, blah. But could we just step back for a moment and just imagine a world where we help people who are struggling with opioid addiction? We get them the supports they need and treat them with respect and dignity. And who knows, if all goes well, maybe they can reintegrate into average everyday society and all is well. I hope so. Something that you may or may not know about addiction and recovery, and this isn't just opioids, be it mental health or weight loss or anything in that vein, is that every single time a person relapses, it makes it that much harder to get